All right. So without further ado, Advanced Practice Providers, September 3rd, Coping Skill Development for Healthcare Providers Caring for Patients with Cancer with Melinda Manning, JD MSW CPC, and Rachel Rifkin LCSW. Let's go ahead and meet everyone and get started. So we do have a bio there, but I'm going to go ahead and pick out some top three things that we thought you would be interested in about Melinda Manning. She's the director of the hospital's Beacon program. She is the chair of the CISM team and serves on the Hospital Ethics Committee and as a content expert with the Wellbeing program and teaches at the UNC School of Social Work. And she presented at numerous national and international conferences about intimate partner violence, Title IX, ethics, and victim advocacy. Melinda, welcome. We're really glad to have you here today.
Thanks so much for having me today.
Absolutely. And what's one thing we should know about you outside of your professional bio?
Gosh. Well, I'm actually running for public office for the first time right now. So,
Wow. Wow.
yeah,
Oh my gosh.
yeah.
Okay. Well, we'll look forward to hearing more about that and hope that all goes well. And then we also have with us today Rachel Rifkin. Oops, I'll go back to that slide for just a moment. But rather than reading all of that, we're going to let you know that Rachel is a clinical instructor and psychotherapist with UNC School of Medicine, Department of Psychiatry, and she provides therapeutic services to individuals and groups through the Department of Psychiatry, as well as support to the Integrated Wellbeing Program for UNC Healthcare, and that the IWPP is dedicated to providing support to a variety of forms to UNC faculty and staff designed to promote professional fulfillment, to reduce burnout, and to maximize resiliency. Rachel, welcome. And for you as well, what's something outside of that professional bio that we should know?
I think I'll let you know that I have two cats, one of who I'm pretty sure is gonna make himself known in the background. So that is my heads up for today, and they bring me a lot of joy, but they're also pretty involved.
That is great. That is great. We're big pet fans with quite a few between us at the Cancer Network here. So always look forward to seeing more. Okay, well, let's go ahead and get moving. I mentioned poll everywhere. The question that this is always a softball at the beginning. Caregiver burnout is a state of physical, emotional, and mental exhaustion that can happen while you're taking care of someone. This is a true, false. I see some folks have already jumped in and answered that, but we'll wait about 10 more seconds. I kind of think they're doing pretty well, but Rachel, Melinda, they're saying true, 100%. How are they doing?
You're correct. That is true.
Okay, good deal. Well, with that, coping skill development for healthcare providers caring for patients with cancer, and I'll let the two of you take it away from there.
Okay, and I'm going to go ahead and get us started. So I always think it's really nice to begin with sort of just a moment of pause, a moment of stillness. So I'm going to ask folks just to take a second and really notice the contact that your feet are making with the ground. Maybe notice any sounds you can hear in your space. And then if you can, even shifting a little bit further to noticing your breath. And maybe taking a couple of intentional, nice long inhales and exhales. Just giving your body a chance to sort of make the transition to this time and this space. And we're going to talk a little bit more about sort of like the power of the breath as we go along. But in the meantime, I am curious, just want to give a pause for people to notice what happens in your body, what happens in your mind with that really small micro practice. And I think sometimes we have a urge to label things as good or bad, right or wrong, and really wanting to encourage us to try and stay away from those labels and just notice what happens. So it's possible you notice a lot of chatter in your mind. It's possible you notice tension in your body. It's possible you might notice like a little bit of tension easing from your body. There's no right or wrong, just giving ourselves a moment to sort of slow down for a second. So I always think that's a nice way to start these kind of our presentations and our time together. So I think a note before we begin is I really want to encourage folks to look for what you're already doing to take care of yourself. My guess is that most of the people who are participating today probably have a lot of things that they're juggling, a lot of people that they're taking care of. And my hope is not that this becomes other things to add to your list, merely just things to think about. So looking for what you're already doing to take care of yourself, remembering that this is not a one-size-fits-all approach, which we'll talk about more later. And then finally, just knowing that you can take what resonates, what feels relevant for you, what feels helpful for you, and you can leave the rest.
Okay, so just real quickly overview about what we're going to be doing here today. First, we're going to really spend some time kind of defining the problems and really fleshing those out a bit, just so we can kind of all be on the same page moving forward. And then we're going to talk about what are the signs, what are the symptoms, what is it to look for if we are approaching a state of burnout. And then lastly, what to do about it. We don't have the magic answers. I'm going to go ahead and tell you that, but hopefully there are some things, some wisdom, some tools that we can give you to really help you as you move along in your most difficult work that all of you do each and every day. So first, kind of what are we talking about? So of course, that opening question kind of already gave you a preview about it. So there's a lot of different definitions of burnout out there. This is the one that we like using just because we feel like it's the most holistic one and really looks at just kind of all the different areas of our lives that burnout can affect. So first, certainly that exhaustion piece. And we're not necessarily talking about physical exhaustion, even though you may feel that too. Really thinking about when we enter that state of just kind of emotional, cognitive, psychological exhaustion as well. The second piece is just kind of when you start to feel that kind of uncomfortable mental distance from your job. Now, obviously, we're not talking about healthy boundaries. We all need to have healthy boundaries around our work. What we're talking about here is that when you just start to kind of feel checked out from your job, from your day-to-day routine. And then the third piece is simply when you feel like your professional efficacy has been reduced. And that could look like such as you're just not as motivated. You're not really thinking about signing up for continuing education, for example, just because you're just not feeling it as much as you used to. Maybe in some severe cases, you may not feel like you're really performing at 100% like you want to be. So again, these are kind of the three dimensions of burnout really to be alert to. And this is one excerpt that I'm not going to read it to you, but this is just one that really kind of resonated with us, just thinking about kind of our own work. Even though Rachel and I kind of give lectures on this, it doesn't mean that we are immune to this. We certainly, I'm sure from time to time also this kind of starts to creep up in our lives as well. The piece of this that the first time I read this that really resonated with me is that when you're burned out, you start to feel negative, not just about your work, but about people as well. And those things that we used to really enjoy, we don't enjoy anymore, or we enjoy less when we're really feeling burned out. And the next thing we want to define for you is compassion fatigue. And so again, this is not our definition, but this is one from the literature that we both really like a lot. And that really is thinking about you have that diminished capacity to care. It doesn't mean that you're not caring at all. It just means that you maybe caring less, and that's bothering you that you're caring less. We all of us who work in healthcare are going to have some exposure to our patients suffering. That's just part of that, unfortunately, is part of the job. But when it happens over and over and over again, and it really starts to affect how we feel about our work, that's when it really sets into compassion fatigue. All right, so what are those signs and symptoms? There's a number of them. And again, this is certainly not an exhaustive list by any means. With behavioral, certainly, mentioned there increased use of alcohol or other substances, but that isn't the only, that's kind of not the only ways. When we think about alcohol and other substances, we think about those things we use to kind of numb ourselves, right? So we don't feel things as much. It's not always alcohol or other substances that we do that. It could be binging too many shows on Netflix. When we do that, that is another way of emotional numbing. Also scrolling, or as a lot of people call it, doom scrolling, playing endless games on our phone. That also is another way that this can look like as one of these behavioral signs and symptoms of burnout. Next, we're thinking about the cognitive piece. Sometimes when we're really burned out, we really just have a hard time concentrating. Our mind just wanders to other things all the time. We maybe actually become more forgetful. And again, this isn't just at work. This could also be at home in your personal life as well. Also another thing to really be aware of is that we're just a lot more pessimistic about everything. We don't see anything ever getting better. The next kind of area of signs and symptoms are those emotional ones. I always focus on this irritability piece. For some of us, we are kind of, when we're feeling burned out, we really have a very low mood. We may feel kind of sad, but for others of us, it comes out as irritability, right? We start snapping at people. Even small things that wouldn't ordinarily bother us begin to irritate us. That's another way it comes out instead of sadness. For some of us, it can look like anxiety, increased anxiety, or even go so far as panic attacks in some cases. And then the last area are those physical signs and symptoms that some of us may feel when we're feeling burned out. Certainly, as you can imagine, it can result in sleep disturbances, having a harder time going to sleep, or waking up often in the night, or just not feeling as rested. The GI upset, that's one that a lot of people feel. That's the one sometimes we're embarrassed to talk about, right? But that very much can be a sign, a symptom of what we're going through with our burnout. Headaches, right? Increased fatigue. These are all some of those physical signs and symptoms that you may experience. All right, I think we are here for our first question. Burnout, this is another true or false. Burnout has 3 distinct dimensions. Wow, y'all are fast. I am impressed. I'll give it a few more seconds. Okay. Those of you who said burnout has 3 distinct dimensions, you are correct. That is true, at least this definition that we like to work with. Great job, everyone. So we also want to have a note as we kind of talked about all those kind of signs of symptoms of burnout. Just be aware is that a lot of these signs and symptoms, there's an overlap between this and depression and anxiety, but there's some big differences between the two. Burnout is really situational, right? If you take away the situation that's causing you to be burnout, then usually you're gonna start feeling better, right? If you are experiencing depression and or anxiety, those are just broader mental health issues that are separate from burnout. Those are going to persist whether you stay in the situation or not. Now, it's also important to note is that when people are who experience burnout, particularly extended periods of burnout, that can then lead to depressive episodes. Not necessarily, certainly not true in every person, but just be aware that kind of this burnout that's not dealt with can lead to depressive episodes. All right. And I think I'm going to turn it over to Rachel at this point.
Yeah, so at this point, we're going to kind of shift from thinking about what is bringing us here, right? This conversation about what could burnout and compassion fatigue look like and feel like, to thinking about what are some of the strategies or practices that we might want to think about building into our lives sort of as protective factors. So I love to talk about mindfulness. I get a little bit nervous talking about it because I think it's a pretty big buzzword right now, and I think a lot of us are kind of inundated with this message that we should do mindfulness, we should practice mindfulness, and there is a fair amount of research to support that. But I think really wanting to be concrete and specific about what we're talking about. So this is not necessarily right, like carving out specific time, sitting in, the lotus position, Buddha on the mountaintop. That's not necessarily what I'm talking about. When I'm talking about mindfulness, I am talking about paying attention on purpose to the present moment, non-judgmentally. This is actually incredibly challenging and is a skill that we want to look to sort of build in these tiny little ways, right? I like to think of it as a muscle that I'm trying to build. And this is really challenging for like a number of reasons, right? We don't necessarily live in a society that promotes these practices. We live in a society that really encourages multitasking and productivity. We live in a society where we have lots of things pulling on our attention at one time, right? We have email going, we have our phones going, we've got the TV, right? We have a lot of things pulling on our attention. And of course, non-judgmentally, which for me is the real sticker, right? We live in a society that likes to put labels on things, good or bad, right or wrong. And so really wanting to highlight that this can be a challenge. But really, I can be doing anything while sort of trying to embody these components. I can be interacting with loved ones. I can be having a meal. I can be doing an activity. And I think another question that I think comes up is like, why? What is the point? Let's pause and just think for a second. How much of your time is spent thinking about what might happen in the future versus things that have happened in the past? I think humans have a tendency, right? Our brains want to go in those directions. And there's a time and a place for that, right? I'm not saying I never want to be intentional and make plans for the future. I'm not saying that I never want to sort of like be reflective about things that happened in the past. The question really is I would like to have some control over that. Right. So this mindfulness practice, building this practice of tuning in to the present moment, trying to adopt this non-judgmental stance when I look at what's happening in the present moment, can be a real resource. I think if this is very new and unfamiliar, I really encourage people to look for sort of like micro practices. These suggestions came from an article that sort of, that came out kind of during COVID. And the authors sort of came up with this strategy of looking at any recurring event as a cue for a self-check. Right? So putting on hand sanitizer, waiting for a computer to load, getting in a car, getting ready to start a meeting, right? Is that a moment that I can sort of slow down and check in with myself, take a couple of deep breaths, notice where my feet are, right? Notice the contact that my feet are making with the floor, checking in to see what my body needs. Am I hungry? Have I had anything to drink today? I'm sure I know for myself, there are days when it's like 3 o'clock and I look at the clock and I'm like, I haven't even had lunch yet today, right? We just get so swept up in the moment or swept up in the day. And then checking in to see what emotion might I be carrying? What am I feeling in my body? So this is just sort of some suggestions on how you might begin to think about practicing mindfulness. Again, I really want to just highlight that there is no one way, there's no right way or wrong way. In fact, there's a quote that I really like that talks about, if someone sits down and tries to sort of practice this, let me go back for a second, tries to sort of practice these 4 components for 5 minutes. And over the course of those 5 minutes, they have, 100 moments that they kind of can check those boxes. But 100 times their mind wanders away and they start thinking about what comes next, or they start putting a judgment on something. It still is 100 moments of mindfulness, right? So it's not even so much that I never wander away, it's that I notice when my mind is going in that direction and I can sort of slow things down and bring myself back. Another sort of practice that I think is valuable to talk about as we're thinking about navigating burnout and compassion fatigue, and that is another thing I really like to talk about, is sort of this idea of self-care. I think, again, we live in a society that sort of gives us a lot of messages about what this means. And so it's, I think worth it to spend a minute kind of just busting some of those myths before we talk about what it actually is. So I think things that I have heard people say are, right, like taking care of myself is selfish, right? I should be making sure that everyone else in my life has what they need and want before myself, right? I put myself at the very bottom of the list. I think we get messaging that this has to be something really expensive or luxurious. This is some product that I buy or some service that I buy for myself. And I think we're going to see that self-care doesn't have to cost anything. It doesn't have to, in fact, like it can be sort of these really basic tasks that often, as overwhelm and stress build, are kind of the first things that start to get kicked off of my list. And that sort of speaks to this time consuming point, right? This doesn't have to be, right, like I carve out 2 hours on a Saturday for a long bubble bath. Sure, that could be very like restorative. And if that's sort of like ticks a self-care box for you, that's lovely. And it doesn't have to be that, right? And then the last sort of myth is this idea that it's earned, right? Which I guess it kind of ties into the first one, right? I can only do these things for myself that I want to do once I have been so productive, or once I have finished these things on my list. And really wanting to kind of break that idea and encourage us all to recognize that, like, this is every human has the right and to take care of their bodies, to take care of their minds in whatever way that looks for you. Excuse me. So if we were to think about, okay, we just sort of talked about what self-care is not. Let's talk about what it is. So this definition comes from a book. It's called Real Self-Care, Bubble Baths, Cleanses, and Crystals Not Included. I really recommend it. I really enjoyed it. It really kind of expanded my own idea of what I think of when I think of self-care. But this author sort of defines it as an ongoing internal process that guides us toward profound emotional wellness and reimagines how we interact with others. It requires self-knowledge, self-compassion, and ultimately the willingness to make difficult decisions. Right? So this idea that really checking in with ourselves, really looking internally to see what is the thing that fills my cup. What is the thing that I am needing or looking for or missing in my life? And then how can I start to find small ways to build that in? Right. And again, I think speaking sort of to sort of the limited view or the limited scope that we maybe default to when we think of self-care as sort of like, bubble baths or massages or going to a yoga class, really wanting to recognize that this can be so many different things, right? We're talking about, how do I take care of my physical body? Do I get enough sleep? Am I getting the right movement for my body? Do I go to the doctor when I'm sick? Do I use my PTO when I'm sick? Right. So these things fall, thinking about this physical bucket of self-care. Emotionally, right? How am I taking care of my emotional self? That might be, taking a break from screens. That might be going to therapy. That could be spending time in nature, right? It's really whatever sort of resonates for you. Social. Humans are social creatures. We do need connection and community, some of us more so than others. But thinking about, right, who am I spending time with? How do I feel when I'm spending time with these people? What boundaries am I setting so that I can protect sort of the time that I want for myself? Mental, right? So thinking about, how am I taking care of my brain? Spiritual, this can, right, look like so many different things depending on what resonates with you. I think for me, this, I always think of spiritual as sort of like anything that connects me to something bigger than myself, right? And so spending time in nature is a way that I feel like I kind of fill my spiritual self-care bucket. And then professionally, right? A huge amount of our lives are spent working, and thinking about, am I using PTO when I'm sick? What are my boundaries with work like? I think this was something that came up a lot during the pandemic, right? As the lines between home and work became so blurred. And so thinking about, what does my practice look like of making the transition from work to home? And right, and there's lots of overlap in there, right? So I think, because I think I get nervous when I talk about this, that it just seems like so overwhelming and so daunting. Oh my gosh, that's a list of so many things. Again, look for what you're already doing. And if there's a place where you're like, man, I'd really like to spend a little bit more time cultivating a little bit more of my physical self-care, what is like some really small practice that feels accessible right now? It doesn't have to be like signing up for a marathon, right? Can this simply be like, I'm going to maybe try and go for a walk after work instead of just sort of like, melting into my couch and finding myself scrolling on my phone.
Hey, I'll share a quick one for physical.
Yeah.
About 6 months ago, I put a small set of hand weights in my office. So between meetings, I will literally, yeah. And so because I was struggling with finding ways to kind of incorporate more movement, more exercise. So there are ways that we can, just small ways, just to do a little bit. And I can't tell you how it's given me so much benefit. So I just encourage everyone is to come up with even a tiny little way to do it.
Yeah, I think if you're looking at your self-care, or your physical bucket, and you're like, man, there's a lot of stuff in there. Is it like just taking a daily vitamin? Is that the thing you want to like think about? And I think that would be a win. I love having weights sort of in, an accessible place, right, in my office. Yeah, so again, this can look like whatever you need it to look like. I'm going to go forward because I'm trying to remember what my next slide is. Oh, yes. So some things to point out here, right? This can be as small as you need, right? If you want your daily vitamin to be your physical self-care check for the day, go forth. I love it. Not a one-size-fits-all approach, right? So again, if we were to think about these categories, I love to give the example when I talk about this one, when we think about the social bucket, right? I consider myself a pretty introverted person. My job is very social. I spend a lot of the day talking with people, and at the end of the day, I'm kind of spent. So my social self-care looks very different from someone like my husband, who works from home and is very social and gregarious and loves to be around people. So it will look different for both of us, and that's okay. And then I think the last thing I'll note is this can change over time and transition, right? What I need, what I'm looking for at this moment, at this stage in my life, could be very different from a year from now, when maybe there's been a big life change. And so recognizing that this does not have to be some static, rigid practice, that this can ebb and flow with what is really being needed for you in your own life. So we have another poll question. So there is one right way to approach self-care. Yeah, you guys are really fast. I'll pause for one more second just to give it another moment, but yes, that is correct. There is no one right way. This can be whatever you need, whatever you're looking for. Yes, nice work. And then I think, right, I'm Melinda and I both have social work backgrounds, and I think we love to think about. I never get tired of talking about emotions with people. So if I was just going to focus in on one of those buckets for a second, thinking about emotional self-care, right? So some questions you might want to ask yourself: do I have healthy ways to reflect on and process my emotions? Do I spend time engaging in activities that leave me feeling recharged? Do I have healthy-ish ways to process my emotions? Do I give myself opportunity to get away from distractions, right? I love that we have these devices that in some ways keep us really connected to people. And, right, the downside is that we are, there's always something to be occupying our minds with. And so giving ourselves an opportunity to maybe just slow down. And then this last one, which we're going to talk more about, is checking in with the nature of your inner dialogue, right? What does that inner voice sound like? How do you talk to yourself? How do you treat yourself? And again, I'm keeping my eye on the clock and I want to make sure I leave enough time, but one more plug for the mindfulness piece, right? Can we see how there's a connection between being aware of what's happening within me and around me and being able to answer these questions? Right? So that mindfulness is sort of like this superpower in the sense that I'm cultivating this awareness that allows me to be like, oh, that's that sort of like harsh inner critic that I've been thinking about, right? I can sense it because I'm a little bit more aware of what's going on. I'm moving away from that autopilot. Let me just pause for a second and see if there's anything else I want to say about this. Yeah, I don't think so. I think, I like these questions as just sort of like a little bit of a self-assessment to sort of think about, how is my emotional self being taken care of? And is there anything that I want to do differently? And again, it could be the tiniest little thing, and that would count.
Okay, and so we're going to spend a little bit of time talking about we all have those internal self-critic, and some of ours are probably harsher than others. I'm actually one of those who's a very harsh one, I will tell you. And some of you maybe who know anything about cognitive behavioral therapy may recognize what's here on the slides. And so this is the triangle that we talk a lot about. And so here's what's important to know is that our thoughts, emotions, and behaviors are all very much interconnected. And going back to what Rachel's been talking about, mindfulness helps us to really see these connections and change these connections when we really become more aware of kind of what we're really feeling on the inside, whether that's, positive feelings on the inside or negative feelings on the inside. That helps us to recognize how our emotions affect our thoughts, how our thoughts affect our behaviors, and of course, background again, how our behaviors also then affect our emotions. So really thinking about how, for example, if you are, having a day for whatever reason, we're feeling kind of what I call a little stormy on the inside, thinking about how that affects how we're thinking about the day, how we're thinking about our work with patients, and also how our inner emotional self may also kind of affect our behaviors, how we go about our day, how we interact with others, what we say to others. So really becoming aware of this really can just be absolutely transformative. And also, as Rachel said earlier, kind of thinking about mindfulness, this also takes practice. It's kind of exercising this mental muscle, trying to kind of recognize these connections. And also just realizing that, if you, as you could see from the triangle, when you change one, right? So if you start changing your thought, if I start changing my thought that I'm not good enough, right? How that in turn can affect your emotions and your behaviors and can lead to so much positive change. And again, it takes practice. It's a matter of kind of catching yourself, when you start to have that harsh emotional critic. And we'll talk more about this in a later slide. But here's kind of an example of this, going back to kind of thinking about self-care, that emotion, that thought that we may have, I don't need this, I shouldn't need this, right? I'm not worthy of this. And when we have those thoughts about ourselves, this leads to kind of frustration and shame. And shame is a really powerful, incredibly powerful emotion that's just very, very negative and really, really hurts us. And so recognizing that we kind of, when we have that sense of shame about, what we're doing, what we're not doing, can really lead us to overworking. And then again, it kind of goes back into the spiral. I'm not working hard enough, so therefore I don't need self-care. And then having shame again when we do engage in self-care, as you could see what kind of a very damaging kind of triangle that some of us kind of go through, thinking about what we could do just to stop one of these things, and checking ourselves and how that can affect kind of our overall well-being. All right, so here's another quiz question. My thoughts and emotions can influence my behaviors, true or false? Okay, y'all are amazing and brilliant. So that's absolutely true. Okay. Rachel, I can't remember if this is me or you.
I can't remember either. I can take this one.
Go for it. Yep.
So I think if we were to think about, right, awareness is kind of like step one, is I want to start noticing what's happening in my body, noticing what's happening in my mind. Can I identify what that thought is? Can I notice how that particular thought might be influencing my emotions and my behaviors? Right? The question becomes, well, what's next? What do I do once I've started to kind of cultivate that awareness? And so I think that, there's probably many things, but sort of the two things that probably are we want to focus on for today, right, is really being curious about, I think the two questions that I ask people a lot are, is that a true thought, and or is that a helpful thought? It's interesting when I'm going to go back for a second. When I talk with people about this cognitive triangle, often they'll say to me, well, I don't actually have thoughts, I just have emotions and behaviors. And I think the reason that happens is that our thoughts are so quick, they're so sort of like instantaneous, that's one barrier. And I think another barrier is that we so rarely push back on what we're thinking. And I think you would be surprised how much chatter is going on throughout the day, right? We're constantly having thoughts about things that are happening. And I think, again, we would be surprised at how often the thoughts, the beliefs, the assumptions, the interpretations that we have are not actually true, or not actually helpful at moving us in the direction that we want to go. Sorry. And so I think going back to this idea of awareness is, once I become aware, can I start getting curious with myself about, well, where is that thought coming from? Where did I get that, that belief that that it's my job to make sure everyone else is taken care of before I do this thing for myself, right? What is the origin story of that? We also sort of have, we call them there's a lot of names for them, but cognitive distortions, stinking thinking is another name, thinking traps. These are like patterns of thinking that a lot of us tend to fall into. All or nothing thinking is one sort of pattern. This is that very much like black or white, all or nothing, no room for shades of gray. That's sort of a pattern to start looking for. Catastrophizing, right? This is that worst case scenario. What is it? I get stuck in traffic. I'm going to be late for work, and my whole day is ruined, right? The whole day is just gone down the tube. That might be an example of sort of catastrophizing. And then minimizing is this, this is kind of when it can be either minimizing or maximizing. This is either when I filter out evidence and I focus on one piece of the story, or I put like a lot of emphasis on sort of one piece of the story. I'm trying to think of an example for that. I think one that I typically think of is, if as a therapist, right, if I have one client who says, I'm really just not happy with the work that we're doing, I think I'm going to look for another therapist. Suddenly, I'm the worst. I don't help anybody. I'm a terrible therapist, right? Well, minimizing, I have, shut down the fact that I still have, 28 other people that I meet with weekly who I do get really, positive feedback from. So that might be an example of minimizing. And then the other thing that we wanted to talk about is sort of like self-compassion. This is another sort of topic that I think might be a buzzword right now, in addition to mindfulness. I am going to read this quote because I really like it. Self-compassion is when we enact compassion for ourselves. That is, we become aware of our suffering and attempt to do things that will be helpful for us, such as addressing a problem, attempting to put a failing in perspective, and being kind to ourselves. So tying this back to what Melinda was talking about with this inner critic, right? I think, again, a lot of us have a tendency to be a lot harsher with ourselves than with others. And, encouraging us to start getting curious, what is the outcome of that, right? A lot of people will, well, that actually motivates me, or that's how I get things done, is when I beat myself up. And I think research really shows that that's actually not the case, that it is possible to be gentle and kind and warm to ourselves, much in the same way that we are to others, and still sort of like accomplish things and still get tasks done off our to-do list. In fact, perhaps we might even be, more productive, or I'm blanking on a synonym for more productive, but right, that we might even find ourselves being more productive. The other thing I want to point out here is I think a lot of people think this is just like a pass, right? Oh, you just want me to give myself a pass. And that's also not necessarily what this means, right? I think I can be compassionate and gentle with myself and still think about what I need to do to move towards change, right? If there's something that's showing up in my life that's really not serving me, can I get curious about what's happening and think about what I want to do differently? That doesn't have to mean I just berate myself and rake myself over the coals and call myself all these horrible names. So that's sort of a thing to think about. And, I think we'll pause here for sort of like a self-compassion practice. I don't think I'll spend too much time on here because I'm remembering, I think that we want to start wrapping up around like 12:52 to give time for questions. I hope that I didn't make that up. But maybe just pausing for a second and thinking about, how do you approach a friend or loved one who is struggling? Right? So maybe think about the last time someone you care about came to you and was like, oh, I had this horrible day, or I did this thing, I can't believe I did it, I feel terrible. How do you show up for them? What is your body language? What is your tone of voice? What types of things do you say or offer them? Right? So maybe just taking a moment and trying to think of, what are some of your go-to, good friend phrases. And I'll just pause for a second to let folks think. maybe even jotting a couple of things down. And then shifting that perspective for a second and thinking about, how do you meet yourself during moments of suffering, when you've had a bad day, or you've made a mistake at work, or you forgot to do something that you really wanted to do, right? How do you treat, meet, show up for yourself? What is your tone of voice? What types of things do you say? So again, I'm not, I know that there's probably limited opportunity for people to chime in, but I think for myself, right, if I were to answer these questions, I think I notice that I tend to be a lot softer with with others in my life, right? I'm very quick to be like, oh, I should have known better, or why did I do that, or what's wrong with me that I can't get this right, right? That tends to be my default. And even after, right, like 10 years of doing this work, you know, I I think I've made progress, but this is an ongoing practice, right? Again, so I think just going back to that point of like looking for these really tiny baby steps, because this is hard work. I want to just pause and see, Melinda, is there anything that you want to add here? Excuse me.
No, you did a fantastic job.
Okay. So I think, we've just done this sort of self-compassion practice to do sort of a quick review of the things that we've talked about. We've kind of set up this idea of what is burnout, what is compassion fatigue, what do those look like, feel like, and then thinking about what are some concrete practices that I might start putting into practice in my life. Right. So we talked about mindfulness, this idea of paying attention on purpose to the present moment, non-judgmentally, which again, I always like to ask people, which one of those seems the hardest to you? And I mean, not always, but often the answer is non-judgmentally. That one's the hardest for me. Right, which we talked about how that can be done doing anything, right? And in fact, probably the best way to start practicing that is with those really small things. When I'm going for a walk, can I really practice just being in this experience of walking instead of ruminating about what comes next or all the things from my to-do list that I didn't get done? So we talked about mindfulness. We talked about sort of self-care and getting curious about beliefs that we might have about self-care, and really recognizing that true self-care is a very multifaceted, multidimensional approach to taking care of our bodies, our minds, our spirits. And that can be as big as you want, as small as you want. And that will evolve over time, depending on what's happening in your life. And then we also talked about the role that our thoughts play, right? In this cognitive triangle, starting to get curious about the link between our beliefs, our emotions, and our behaviors, and looking for all or nothing thinking, looking for catastrophizing, looking for minimizing, and then finally thinking about how to build in more of a self-compassionate stance. So as a quick review, but thinking of these reflection questions, wanting people to just start by, again, noticing, what are you already doing, right? Is there something small that maybe you didn't realize that that's actually self-care practice? When I made my annual physical appointment, that was actually me really prioritizing taking care of myself. And maybe I noticed an urge to cancel that so that I could do something for someone else, but I still went to that appointment. That's a beautiful way to take care of your physical body. And then thinking about the question is, what is one practice you would either like to learn more about or begin putting into practice today? So those are kind of our questions for reflection. And I think, I'll let Melinda talk for a second about sort of resources.
Yeah, so just a couple of resources. Certainly, if you go on to the wellbeing program page there are kind of different prompts for different resources. Part of that, the Taking Care of Our Own program, which is therapy, largely and really geared towards the needs of us as School of Medicine and UNC Health employees. So check that out. The next is a short video of a self-compassion practice that just suggests taking a look at if you have time. Just going to, it's really good. She guides you through some more questions and again, help you think about how you can incorporate it into your own life. At the Beacon program, we have a SharePoint that's open to, actually it's open to everyone in the UNC Health system, but there is a folder in there marked self-care. And so there are some of us like things like worksheets and just kind of some more things to try or to try with you or to try with friends or to try as a group in there as well. So also if you have time, check it out. And of course, our citations, because we did not just all make this up. We actually looked at a lot of literature that was in research that's out there. Okay, so we are ready for all your questions.
We sure are. And while we're waiting for a few to come in, I want to introduce Megan McElfresh. And she is the new course director, and we are very excited to have her on board. She has very graciously volunteered to take on this role as course director for the APP lecture series, oncology lecture series. Megan, welcome.
Thank you, Tim. I'm excited to be a part of this. And thank you, Rachel and Melinda. This was a great presentation.
So, Megan, our audience will get to know you more in the next APP lecture. You're with the Division of Oncology here or of Hematology here at UNC, and we're really excited to have you on board. And I know our audience is going to look forward to having a host who is an APP and not a technologist, so that'll be great as well. So let me look and see if, as in my moderation tool, still waiting for questions to come in. Just a reminder to everyone, you can go to pollev.com, put in the letters UNCLCN, and share your questions there. I know I've got a couple. Megan may have one or two while we're waiting for those others to come in. I'm curious for Rachel and for Melinda, as we think about oncology and some of the particular challenges that there might be there. Some of these would be common to other fields as well. But are there some things that you think about and some strategies specific to people with cancer-related careers?
Gosh. I'll start. I'm a big believer. I think an important part of self-care is setting boundaries. Really, in particular, not taking your work home with you as much as possible. The reason it's so important for me is that, of course, I work in the field of violence, and so we deal with a lot of really terrible things in our work. And so for me to have been able to do this work as long as I have, I've had to have really good boundaries. For example, one of my boundaries, which a lot of people find very odd, but it's one that works well for me. I never work from home because for me, I need to physically be able to kind of leave that emotional piece of my work in my office and not bring it home with me. So that's just a boundary that I've employed for many, many years, even during the pandemic. That has really worked well for me. And so all of us have to kind of come up with those that work for you. But for me, that's something that I think in your work, probably something to really think about. Or what boundaries are you setting between your personal life and your work?
Yeah, I don't know if I have anything specific to, I think a lot of these are sort of applicable regardless of sort of what population. I think I would echo Melinda's sentiments around boundaries and just encouraging a lot of self-compassion. I would imagine that it's particularly emotional work and really wanting to encourage folks to meet themselves with as much gentleness and kindness as they can, and recognizing just the hard work that's being done.
Great. Thank you so much. Megan, anything that you'd care to share? Apologies if I'm putting you on the spot.
No, you're fine. One thing was, I know you guys really spoke on the importance of non-judgment, which I know is hard for a lot of us. Do you have an example of maybe a non-judgmental response when you're trying to practice mindfulness?
Oh, that's a really good question. Yeah, I think so the one that's coming to mind immediately for me is thinking about emotions. I think a lot of us have a tendency, right? There are emotions that we like and there are emotions that we don't like. And really wanting to recognize that all of our emotions serve a purpose, right? I would never want someone to not have the experience of fear or anxiety, because that is an emotion that is keeping us alive, right? Maybe there's times I want to turn down the volume on it, but I think the tendency to label an emotional experience as good or bad, right? So, oh, I feel this pit in my stomach. I feel my heart is starting to race. I'm anxious. I can't stand it. I want to get rid of it. How do I get away from this experience? And right, and really wanting to be like, can I actually just see this for what it is, instead of labeling this as like something I can't stand, or it's bad, or I can't be anxious, I shouldn't be anxious, and just recognize, oh, that's what that is. I have, I can feel a little bit of tension in my shoulders. I can feel that I'm like worrying about something. I can recognize that, work has been more stressful. I think that might be anxiety. I wonder what I want to do with that or for myself to navigate that emotion. So that might be one way that I would think about sort of applying the non-judgmental stance. But I mean, that's a really good question there. I think I would even say just starting to notice your judgments, right? Mm-hmm. Just maybe like making a little alert on your phone and pausing throughout the day and just, doing a moment of reflection. How many, things have I put in the bad bucket already? And how has that sort of like served me or not served me? And can I start thinking about sort of trying to just drop the judgment a little bit?
All right, Rachel, thank you so much. We are just about at the hour, and I don't see any questions that have come in online, so I am going to go ahead and cover a few more things we need to do in wrap up. We want to thank the state of North Carolina for their funding of the University Cancer Research Fund, which funds this group. We want to thank the UNC Lineberger Comprehensive Cancer Center. We want to thank the team here at the UNC Lineberger Cancer Network, Benny Obure, John Powell, Oliver Marth, Andrew Dodson, Patrick Muscarella, and Kimberly Riddick. Each of them has a very important role to play in each one of these lectures. So thank you to all of them for their hard work.